Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Elaine Colby. She's a family physician and she wrote the Kevin MD article, When Should We Start Having a Discussion About Palliative and End of Life Care? Elaine, welcome to the show.
Thank you. Glad to be here.
So we'll get into your article in a little bit, but first off, tell me your story and your journey to where you are today.
So I'm from Birmingham, Alabama, and I went to medical school at UAB, and I loved everything, but I would get bored doing the same thing over and over. I couldn't decide what I wanted to do, but very cliche, I wanted to make a difference in people's lives, and ended up choosing family medicine. I followed my then husband to Hawaii, where he did his residency in the Army, and I did mine at the University of Hawaii in family medicine, and we lived there for 5 years. Then I worked for Kaiser there, and then we moved to San Antonio, and I worked for the Army at Fort Sam Houston at Brooke Army Medical Center, and we were there for 5 years, or 4 years, sorry. And then we came back to Birmingham, and I worked for the VA, and now I am in private practice for the first time 10 years after I finished my training. I went into private practice. So I've been in a variety of different practice environments. And when I started in primary care, I really liked the variety and just being able to really treat the patient as a whole and just the jack of all trades, knowing a little bit about everything. And, it's been ups and downs, but I'm really glad ultimately that I made that choice. I've ended up actually my niche in primary care is mental health. So that's a lot of my practice, and I've just done more and more focused on wellness. And so much in modern medicine today, Western medicine, we're just throwing pills at people and excessive care. And through all these different practice environments that I've worked in the past, I've learned so many other ways to care for people. And so much of it comes down to just quality of life and prevention and wellness. And in our culture, where we don't appreciate those things.
And how has the pandemic affected you and your practice?
I think the actually for our practice, the number one thing is the uncertainty going forward with everything. We have been very fortunate, and we have about 35 physicians here, and we're physician owned, so large enough where we have lots of resources and we could adapt quickly, but not too big that we were just overcome with bureaucracy. So we were in a very good situation to adapt and start virtual visits immediately. So we never shut our doors completely. We just converted everybody to virtual visits. So we were very slow for a while. Now Alabama has, pretty much opened back up completely. So we all buckled down for this wave of patients flooding our hallways, and then nothing happened. Nothing. So I think all of it, like the community, we just people got so stir crazy of being holed up. So now we're seeing positive tests rampant, and we're holding our breath for what's going to happen next week.
Now, let's talk about your Kevin MD article. When should we start having a discussion about palliative and end of life care? So, I was wondering if you could walk us through that article and maybe share the story of why you decided to write it.
When I trained in residency, it was kind of a hybrid, half academic, half community program. But when we were on call as residents, it was a very small community hospital. I think we had 20 beds. The only physicians in the hospital were the ER doctor, the upper level resident, and the intern. That was it. We did not have an MRI. We had a CT scanner. We had like 4 beds in the ER. We had 4 ICU beds, and the residents managed the ICU by themselves overnight. So it was an interesting experience, but a very good one. And for a variety of reasons, with that hospital also being an underserved area, we saw a lot of suffering. We're very well trained on discussing end of life care in that program. And so I had just really also just focused on making people comfortable and just witnessed all of the suffering that can happen with prolonged ventilation when this pandemic started, and just watching when it was so quiet here. So I'm reading and watching about everything going on in New York, and I could easily imagine how just horrendous experience it is for the patients and the families and the providers to for being on the ventilator and alone, and it could easily just imagine. Also, in medicine, and I'm hearing all the frustration from these doctors in New York of not not having a cure, and how algorithmic our system is these days. Of, you could just run a person through a computer and not even, I mean, I guess you could argue that we are doing that with our EHRs. But just the human aspect not there. And also, when we don't have an algorithm to follow, it's so frustrating for so many doctors. But in my practice, having focused on wellness and mental health for so long, that, to me, the most important, valuable part of being a physician is being a healer and a caregiver, and just being not, I know I can't cure most things, but I can make people's lives better even if I can't cure them. So I think I wrote that article in about 5 minutes. I was driving home from work, and I must have been listening to something on NPR and thinking about everything I had read, and I was just getting really fired up. Like, why aren't we talking about minimizing suffering, not, ramping up pressures on the vents when these people are dying right in front of us? We could do it better. We could do it better, but we are so focused on getting that cure, which of course is important. We were missing a big piece.
Sure. Now, from a primary care standpoint, what are some of the obstacles that a lot of clinicians face when it comes to discussing end of life care?
Time, for sure. That's probably number one. It can be an uncomfortable conversation if you haven't practiced it. People need to realize that if you're not comfortable with it, like, it's going to be uncomfortable in the beginning. Probably just a time and willingness to be able to just listen. It involves a lot of listening, and maybe, learning how to ask the right questions, and then listen, and not dictate what we think the person needs to do, but to find out what is important to that person.
Now, from your experience, can you share any advice to your fellow primary care clinicians? Any tips that you could share when it comes to discussing end of life care with patients?
In my practice, particularly with my Medicare patients, we do advanced care planning, and I have just come up with the phrase how I approach it with all of my patients. And so it's scripted. And I would say, if you were to have a medical emergency and you couldn't speak for yourself, what kind of things would you want or not want?
So, we're talking to Elaine Colby. She's a family physician in Alabama, and she wrote the Kevin MD article, When Should We Start Having a Discussion About Palliative and End of Life Care? And when it comes to the changing diagnostic and therapeutic treatments, when it comes to the coronavirus, they seem to be changing almost on a daily basis. How do you stay up to date with everything?
I think everybody wants their day in the spotlight, as far as, the breakthrough research, the breakthrough
Mhm.
treatment, and so I will go to multiple sources to cross reference. And I would say that, actually, when I was in college, I read the book, And the Band Played On,
Mhm.
by Randy Schultz, about the AIDS epidemic, and that was a huge eye opener that I've never forgotten.
Sure.
That politics and culture and society, we want science to be straightforward and clear cut, but it's not, because humans are emotional beings, and everybody has their own slant and opinion about it in this scenario when everything is all new and changing and uncertain. So a lot of these things that are going on right now doesn't necessarily surprise me, because I read that book, and this has
Sure.
all happened once before.
And my final question, Elaine, what is your take home message for the Kevin MD audience?
That one of the most important things in medicine is to listen to your patients with respect and empathy, and bear witness. And that's one of the most important things that we can do as physicians ever.
Fantastic. Well, thank you so much for sharing your insight, and thank you so much for being on the show.
Thank you. I appreciate it.